Yes.
And there are various categories of Googling. There are medical write-ups from medical institutions. There are research papers from medical institutions. If you are reading those ones, you're more likely to have the truth.
So what you said about preparation is you take care of the parent emotionally so that the parent can take care of their kid, because anxiety from the parent affects the child. Yeah. So that's one thing I noted. You also talked about using layman language to make it easy for the parents to understand. That one was well explained. Then there's something you talked about operating of these conjoined twins. And I had a question. You see, like when conjoined kids are born, they can share vital organs. So who do you choose to live and who do you choose not to live? And perhaps when you're answering that, you can answer it together with this internet question so that we can let Apondi share her story. You talked about parents are knowledgeable these days. There's something called Dr. Google. Do you think that it's a good idea, because maybe they go into internet, fear of the unknown, maybe they are looking for something to connect with their kids' ailments, the surgery process. Do you think it is a good idea, or should the doctor, because some parents might come back and like try to, for lack of a better word, bag the doctor with the knowledge they've gotten. But I understand there are some other doctors who give permission. Now, for further explanation, go and Google. So what do you recommend?
Thank you.
Yes.
I think I'll start with Google so that we're clear on it. Living in this century, I think information is key for all of us. Even as doctors, sometimes we Google journalism. We get either the correct or wrong information.
Yes.
If I want to paint my house, sometimes I go on Google and I look at the appropriate colors.
Yes.
Sometimes I might get it right, sometimes I might get it wrong.
Yes. Yes.
So I think in the age that you are living in, we do not completely discourage the use of Google to try and get a few medical tips. Because there are simple things in the house that you can, if you have a cold, you can actually go to Google and it can tell you the simple remedies you can make at home. And perhaps you're in a position where you can't either call a medic to give you those tips. And if you know how to search, I think that is the key word. Where do you look for information?
Exactly.
Because anyone can put something on Google.
Yes.
It is us educating people and your patients in which, like some big hospitals or institutions, the Mayo Clinic, most of those, the health institutions, they have a website where they have actually put different diseases from their departments, and they have what we call parent guidelines or patient information. If you are Googling from a hospital institution's website, and whatever you are looking for, you know the disease, and whatever they guide you, that could be closer to what is the correct thing. So we should search for everything on Google, but we should also be careful that some of the information there is not correct. But so if we encourage them, when a patient comes and they have looked at Google and they have actually arrived at a diagnosis, and you listen to the patient or the parent, the child, for us as pediatric surgeons, and then you discover whatever they think their child has is completely different from what you think the child does. Now, that's where the catch-52 is. They have read, they have looked, actually they are so sure that is what is there on Google. Now you have examined, and it's a completely different thing. Now, I think it's about technique on how you handle such patients. I think from what we know, if you know what you're talking about as a medic, sometimes you actually don't need to make the diagnosis for the patient. the training should be sufficient to take the mother or the patient through their own symptoms. Like if you're having appendicitis, for example, you can just start by saying, when you have an appendix, you draw the GIT, and the gastrointestinal system. You draw the colon and the small bowel, and you show them where the intestine is. Then you tell them what is appendicitis. Usually it's just a blockage of the mouth to that appendix. Then you can tell them a hand too can block and the appendix will swell. Now, from there, you start by giving symptoms that you can vomit, you can get a fever. By the time you finish giving the symptoms and summarizing and tying them up, and you ask them, so what do you think your child does? Most of the time they tell you, I think it's an appendix. If it's a hernia, like the groin, the ones that swell down there, or even the umbilical hernia, you can start by telling them what is a bad umbilical hernia and a good umbilical hernia. The bad umbilical hernias, you can start by saying, as your child vomited, is there any pain? Is the hernia always there even when the child has slept? As the child had vomiting, pain, and abdominal distension? So that by the time you finish, by just explaining, you ask them, so do you think this one is obstructing or it's not obstructing? Sometimes if you are so open and receptive and you take the patient through what they have, and even when you're examining, if it's a hernia, take the patient's, their parents' hand, let them examine their hole with you. Ask them, your finger is like 2 centimeters. So if it is going in and you can put it to so many centimeters, do you think this hernia is? So if you take the patient through the examinations, if it's a child, you take the mother, they examine with you. That should be the key thing. Because if the tonsil, for example, is inflamed and it is red, when you put a torch, what you can see, even the patient, the parent can see. If it has pus, they're also seeing there is pus. If it has pain when you touch, even the parent can touch and there is pain. By the time you are concluding, just ask them, so what do you think we are dealing with? Most of the time, they are the ones who actually give you the diagnosis. So if they had something contrary, they will tell, by the way, I think here, it is not what I thought this thing was. And from there, then it's an easy way. Once they say, I think this one is different, that is the time now you get, oh, okay, Google there, I think it was not correct. This is how it's supposed to go. So you can Google, but be receptive to a change of what you Googled.
Yes, yes.
And there are various categories of Googling. There are medical write-ups from medical institutions. There are research papers from medical institutions. If you are reading those ones, you're more likely to have the truth.